Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. How can I assist you today?
Good morning, doctor. I'm really concerned about some symptoms I've been experiencing lately. I've been having frequent bouts of severe abdominal pain, and I don't know what's causing it.
I'm sorry to hear that. How long have you been experiencing this pain?
It started about 2 months ago, but it has progressively gotten worse. Initially, it was just occasional discomfort, but now it's happening almost daily.
Where exactly is the pain located?
Mostly on the left side of my lower abdomen, but sometimes it radiates to my back.
Does anything seem to trigger or worsen the pain?
Eating sometimes makes it worse, especially if it's a big meal, and when I'm constipated, it seems to be more intense.
Have you noticed any other symptoms besides the pain?
Yes, I've noticed some changes in my bowel habits. Sometimes I have diarrhea and other times I'm constipated. I also feel bloated most of the time.
Have you had any episodes of fever, nausea, or vomiting?
Yes, I've had a low-grade fever on and off, and sometimes I feel nauseated, but I haven't actually vomited.
Do you have any history of gastrointestinal problems in the past?
Not really, just some occasional heartburn, but nothing serious.
Have you tried any over-the-counter medications to relieve the pain?
I've tried antacids and some pain relievers like ibuprofen, but they don't seem to help much.
Do you have any family history of gastrointestinal disorders, like inflammatory bowel disease or colon cancer?
My father had diverticulitis and my grandmother had colon cancer.
Based on your symptoms and family history, it sounds like you might have diverticulitis, which is an inflammation or infection of the small pouches that can form in the walls of your intestines. However, we need to confirm this with further tests. I'll order a CT scan of your abdomen and pelvis to get a clearer picture. In the meantime, I'll prescribe antibiotics to manage any possible infection and a pain reliever to help with your symptoms.
Thank you, doctor. Is there anything else I should be aware of?
Yes, it's important to follow a high-fiber diet once the acute inflammation has subsided. Avoiding nuts, seeds, and foods that can irritate your intestines during a flare-up is also advisable. And if your symptoms worsen, you develop a high fever, or you have severe pain, please seek immediate medical attention, as that could indicate a more serious complication like a perforation.
I appreciate your advice. I'll follow your instructions and make sure to take the medications as prescribed.
Great. I'll also refer you to a gastroenterologist for further management and advice on preventing future episodes. Diverticulitis can be a recurring condition, so it's important to have a long-term management plan.
Thank you, doctor. I'll make sure to follow up with the gastroenterologist and take care of myself.
You're welcome. Take care, and don't hesitate to reach out if you have any questions or concerns.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Dr. Hernandez. I've been having these severe headaches and muscle weakness that don't seem to go away. My doctor suggested I see you to discuss possible multiple sclerosis.
Good morning, Mr. Roberts. I'm glad you came in. Multiple sclerosis, MS, is a chronic condition that affects the central nervous system. Let's talk about your symptoms. When did you start experiencing these headaches and muscle weakness?
The headaches started about 6 months ago, but they've been getting worse over the last couple of months. The muscle weakness in my legs began about 3 months ago and has gradually gotten worse. I struggle with basic activities like walking or standing for extended periods.
I see. Have you noticed any changes in your vision? Perhaps double vision or blurred vision?
Yes, actually. About a month ago, I started seeing double, especially when I'm tired. I also have these weird tingling sensations in my arms sometimes.
Thank you for sharing that. Have you experienced any issues with bladder or bowel control?
I've had some bladder urgency lately, where I feel like I have to go suddenly, but I haven't had any bowel issues.
Got it. Do you experience fatigue or difficulty with coordination?
Yes, I'm often exhausted, even after getting a full night's sleep. My coordination has also gotten worse. I find myself stumbling more frequently.
It's important that we consider all possible factors. Do you have any family history of neurological conditions, specifically MS?
No, not that I'm aware of. My family has had some cases of rheumatoid arthritis and diabetes, but no neurological issues.
Understood. Given your symptoms, we'll need to conduct a neurological examination and order some imaging tests, like an MRI, to see if there are any abnormalities in your brain or spinal cord.
How will the MRI help?
The MRI will help us look for lesions or plaques in your central nervous system that are indicative of MS. We may also conduct a lumbar puncture to analyze your cerebrospinal fluid for specific proteins that are present in MS.
What are the treatment options if I do have MS?
The goal of treatment is to manage your symptoms and slow disease progression. This could include disease-modifying therapies to reduce the frequency and severity of relapses, as well as medications to manage specific symptoms like muscle weakness or bladder problems. Physical therapy is also important to help maintain mobility and strength.
Will these treatments cure me?
Unfortunately, there's no cure for MS, but the treatments can help you manage your symptoms and maintain a good quality of life. We'll tailor the treatment plan based on your specific needs and the type of MS you have.
I see. What should I expect moving forward?
If the tests confirm MS, we'll work together to develop a treatment plan that suits you. It's important to maintain a healthy lifestyle, which includes a balanced diet, regular exercise, and stress management. Support from family and friends, along with professional counseling, can also be beneficial.
Thank you for your thoroughness, Dr. Hernandez. It's reassuring to know what to expect.
I'm here to help you navigate this. We'll schedule the MRI and lumbar puncture to get a clearer understanding of your condition. From there, we'll work together on the next steps.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
The recent workshop on pain management strategies was quite insightful. What did you think?
It was informative, particularly regarding the non-pharmacological techniques like mindfulness and physical therapy.
Absolutely. I also appreciated the emphasis on patient-centered care. It's important to consider each individual's preferences when developing a pain management plan.
Yes, and it's crucial to avoid over-reliance on opioids given the current epidemic. The discussion on multimodal analgesia was especially useful.
I couldn't agree more. It's important to combine different strategies to address pain effectively while minimizing potential side effects.
Definitely. We should look into incorporating more of these approaches in our practice to enhance patient care.
Now look at question 26.
Have you heard about the recent changes in the hospital's emergency preparedness protocols?
Yes, I've read through the updates. It seems they've revised the triage process to better handle mass casualty incidents.
Exactly. They're also emphasizing the importance of regular drills to ensure everyone is on the same page during an actual emergency.
That's crucial. We need to be ready for anything, especially in the current climate where disasters can occur unexpectedly.
Agreed. It's essential to keep our skills sharp and remain adaptable in high-pressure situations.
I think we should also consider providing refresher courses for the staff. Familiarity with the protocols is key to ensuring a swift and effective response.
Absolutely. I'll bring it up at the next staff meeting. We need to be proactive about this.
Now look at question 27.
Did you see the recent updates to the electronic health records system?
I did. It looks like they're adding new features to improve data accuracy and patient tracking.
It's about time. The previous version had so many glitches that affected our workflow.
I agree. These updates should streamline our documentation and help reduce errors in patient charts.
Yes, and it's supposed to integrate better with the lab system. That should cut down the time it takes to get results.
Absolutely. This is going to be a significant improvement for us. Let's hope the transition is smooth.
Now look at question 28.
Have you heard about the new initiative to improve patient discharge instructions?
Yes, it's a great move. Clear instructions will reduce confusion and prevent readmissions.
Exactly. They're focusing on simplifying the language and providing visual aids for patients with limited health literacy.
That's so important. It's also going to be easier for us to ensure patients understand their medications and follow-up appointments.
I know. This change is definitely going to enhance patient outcomes. I'm looking forward to seeing how it works in practice.
Me too. It's such a crucial part of patient care, and we can really make a difference.
Now look at question 29.
With the recent advancements in telehealth, how do you feel about virtual consultations becoming more common in our practice?
I'm optimistic. They offer a convenient alternative for patients who can't easily visit the clinic. Of course, it's not a substitute for all in-person visits, but it certainly expands access to care.
Exactly, especially for follow-ups or for patients in rural areas. It's going to be crucial to make sure our systems are secure and that we establish protocols to ensure patient privacy during these sessions.
Yes, and we need to educate patients about the process to ensure they're comfortable with the technology. They need to understand how it works, how to prepare for the appointments, and how to troubleshoot common issues.
Agreed. This shift will require a lot of effort from us, but in the long run, it should greatly benefit patient care.
Now look at question 30.
There's been a significant rise in antibiotic resistance cases lately. How should we address this as a healthcare team?
Education is key. We need to make sure patients understand the importance of taking antibiotics exactly as prescribed and not pressuring their providers for them when they aren't necessary.
And we also need to be vigilant about our own prescribing habits, avoiding antibiotics for viral infections and using them only when clinically indicated.
Definitely. On top of that, we should work on creating protocols to identify resistant infections early on and monitor the effectiveness of antibiotics used in our facility.
That's a great point. We should also consider collaborating with infectious disease specialists to ensure we're on top of the latest guidelines and strategies to combat resistance.
For sure, this is a collective effort, and we all need to be on the same page to tackle it effectively.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello everyone, my name is Dr. Olivia Patterson, and today I'd like to focus on a significant health issue, type 2 diabetes. This condition, which affects millions of people globally, has become a major public health challenge, and understanding its complexities is vital for both prevention and management. Type 2 diabetes, characterized by insulin resistance and relative insulin deficiency, is often linked to lifestyle factors such as obesity, physical inactivity, and poor diet. The body becomes less sensitive to insulin, a hormone crucial for regulating blood sugar levels, leading to elevated glucose in the bloodstream. This can eventually result in serious complications if left uncontrolled. The signs and symptoms of type 2 diabetes can vary. While some people may not exhibit any noticeable symptoms, others may experience increased thirst, frequent urination, excessive hunger, fatigue, blurred vision, and slow healing of wounds. Because these symptoms can be subtle, many people are unaware they have the condition until they undergo blood tests or begin experiencing complications. Risk factors for developing type 2 diabetes include being overweight, particularly with excess fat around the abdomen, leading a sedentary lifestyle, and having a family history of diabetes. Age is also a factor, with the risk increasing for people over 45. Additionally, individuals from certain ethnic backgrounds, such as African American, Hispanic, and Native American, are at a higher risk. Prevention of type 2 diabetes is primarily focused on lifestyle modifications. Adopting a healthy diet that is low in refined sugars and high in fiber, alongside regular physical activity, can significantly reduce the risk. Weight management is also crucial, as losing even a small percentage of body weight can greatly improve insulin sensitivity. Managing type 2 diabetes involves a combination of lifestyle changes and medication. The goal is to keep blood sugar levels within a target range to prevent complications. Medications like metformin, sulfonylureas, and newer classes such as SGLT2 inhibitors and GLP-1 receptor agonists can help manage blood sugar levels. Insulin therapy may also be necessary in some cases. Regular monitoring of blood glucose levels, blood pressure, and cholesterol is essential in managing diabetes effectively. Working closely with healthcare providers to establish a personalized care plan, including diet, exercise, and medication, is vital for long-term success. Complications from unmanaged type 2 diabetes can be severe, affecting various organs and systems. These include cardiovascular disease, kidney damage, nerve damage, and eye conditions such as diabetic retinopathy, which can lead to blindness. Diabetes also increases the risk of infections due to a compromised immune system. Education and awareness are key in tackling type 2 diabetes. It's important to recognize the symptoms, understand the risk factors, and take proactive steps towards prevention. Individuals with prediabetes, characterized by elevated blood sugar levels that don't yet meet the criteria for diabetes, should be particularly vigilant about lifestyle changes to prevent progression to full-blown diabetes. Type 2 diabetes is a prevalent condition that can have serious consequences if not managed properly. However, it is largely preventable and manageable through lifestyle changes and appropriate medical care. Regular screenings, adopting a healthy lifestyle, and staying informed about the condition can make a significant difference. As healthcare providers and individuals, it's our responsibility to be proactive in addressing this health challenge and to empower those affected to live healthier lives.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, I want to share the story of Mark, a man who experienced significant mental health challenges after his diagnosis of multiple sclerosis. First, let's set the stage with some background on MS. Multiple sclerosis is a chronic illness that affects the central nervous system, often leading to physical disability. It occurs when the immune system mistakenly attacks the protective covering of nerve fibers, leading to communication issues between the brain and the body. Symptoms vary widely but can include fatigue, difficulty walking, and vision problems. MS is unpredictable, and its course differs for each person. Now let's turn to Mark's story. Mark was a software engineer, leading a busy life with his wife and 2 young children. In his late 30s, he started experiencing unusual symptoms like tingling in his fingers and unexplained bouts of fatigue. Like many, he brushed these symptoms off, attributing them to stress and overwork. However, when he began to struggle with his balance and experienced blurred vision, he visited his doctor. After a series of tests, Mark received the diagnosis of MS. The news was a heavy blow. The prospect of living with a progressive illness that could lead to significant disability caused Mark immense distress. The uncertainty of his future and the potential impact on his family weighed heavily on his mind. Initially, Mark focused on the physical aspects of managing MS, including starting medications and modifying his lifestyle. However, he soon realized that the psychological impact of the diagnosis was overwhelming. He found himself in a persistent state of anxiety, often catastrophizing about worst-case scenarios. His thoughts were dominated by fears of becoming dependent on others and not being able to provide for his family. Mark's mental health started deteriorating rapidly. He began withdrawing from friends and family, lost interest in activities he used to enjoy, and had trouble sleeping due to racing thoughts. His wife became increasingly concerned and encouraged him to seek professional help. Reluctantly, Mark agreed and was referred to a psychologist specializing in chronic illness. In therapy, Mark explored the emotional impact of his diagnosis and how it affected his self-identity. He was able to express the grief he felt over losing the life he had envisioned for himself and his family. The therapist helped him recognize the unrealistic standards he was holding himself to and guided him in developing healthier coping mechanisms. Through therapy, Mark learned the importance of setting realistic goals and taking things one day at a time. He practiced mindfulness techniques to help manage his anxiety and worked on building a supportive network that could provide emotional encouragement. His therapist also guided him in reframing his outlook on life, emphasizing that MS did not define him and that he still had control over many aspects of his future. Mark's journey highlights the importance of addressing the mental health needs of individuals with chronic illnesses. Often the focus is on the physical symptoms, while the psychological impact is overlooked. Yet, conditions like MS can significantly affect a person's mental health, leading to issues like depression, anxiety, and social withdrawal. Healthcare professionals must adopt a holistic approach when treating chronic illnesses, acknowledging the interconnectedness of physical and mental health. Integrated care models that include psychologists or counselors as part of the treatment team can provide patients with comprehensive support. Additionally, support groups and community resources can be invaluable, offering a space where individuals can share their experiences and find solidarity. While the physical challenges of chronic illness are evident, the mental health impact can be equally profound. Mark's story is a reminder of the need to provide compassionate, holistic care that addresses both the physical and emotional challenges of living with a chronic condition.